So I'll be talking regarding how to deal with severe deformities using Cuvis. And I'm going to share with you the severe deformity cases here. So can we do robotics? I mean, that's a routine question asked by everyone when we are dealing with severe deformity. Is it possible to deal such deformities with robotics? We saw excellent demonstration just prior to this session. So yes, we can. So case number 1, 74 years old gentleman, hypertensive, IHD, bilateral knee pain 8 years ago and operated for fractured tibia 14 years ago. And this is how he presented to us. Right side it was a simple straightforward varus, but left side a gross deformity and with pre-existing implant. And so we had to take out the implant. The challenges were an osteoporotic bone and a severe defect on the posteromedial side. And so this is his post-op X-ray, complete correction of the deformity. So he used to walk like this. This is pre-op and post-op gait of same patient. So complete correction and leading a normal life. Another patient, 72 years old gentleman, pain in both knees since 8 years, no other significant history, and gross deformity as you can see, and severe varus with severe defect on the medial tibial condyle. And this is his post-op X-ray. We had to graft and extension stem, and this is his pre-op gait, day 1 after robotics. And same patient around 4 to 5 weeks post-surgery. So such gross deformities, not only with this system, but almost with all robotics we can tackle successfully once you are used to handling these systems. Another patient with bilateral knee pain since 7 years, defect on the posterior medial aspect of the tibia, and huge osteophytes he had posteriorly. And I had to use an extension stem with graft and complete correction without any FFD. So this is his pre-op and post-op gait. So I thought instead of repeating today morning talk, it will be nice to discuss and share these cases. So subluxated knee and gross varus, complete correction. Another patient, female 57-year-old, she was operated for proximal tibia fracture couple of years ago, diabetic. There were no signs of infection, ESR, CRP and other parameters were normal, and this was her pre-op X-ray, and this is a post-op complete correction and stable knee we could offer her. So another patient, bilateral knee pain, 65-year-old gentleman, valgus knee, and these are his pre and post-op gait or videos. So friends, we'll skip a couple of slides here, and this patient, complete correction, pre-op and post-op video. So complete correction of such varus and or extreme deformities is possible with this system. It's highly precise, and most of the patients we could end up with 9 or 11 poly, and good improved range of movement we could achieve in most of the patients. Thank you very much.